Divya, you'll inform us because I've again streamed it.
Yeah, just started. You can go ahead now.
Great. Welcome, Dr. Dhwani Mago. It's a real honor to have you with us today. Good evening, Doctor.
Thank you. Thank you so much for having me. And it's a pleasure to be on your platform. And I'm just looking forward to, it's such an interesting topic. And so just looking forward to the talk today.
Sure. Thank you so much. And, as much are we. And, would like to quickly introduce you to the audience here as well as to the people who will be watching you live on YouTube. Dr. Dhwani Mago is a practicing obstetrician and gynecologist with an experience of over 13 years. She specializes in high risk maternity care, infertility management, and all gynecological problems and is committed to giving women the best in gynae care. She believes in empowering her patients by educating them about their health and healthcare needs. She has recently received the Women's Health Icon Award from the Indian Society of Artificial Reproduction and is active on all social media platforms to educate and empower women. Wow. Congratulations, Dr. Dhwani. And,
Thank you. Thank you so
diving.
much.
So it's really lovely to have you with us today on a topic which is, I think, very relevant and much talked about, which is, the fertility checkups and the associated issues that women face today. So, if you could just help our audience understand what really are fertility checkups.
Right. So, see, actually, this topic is not very talked about. So, that is the reason that, I wanted to talk about this and to create awareness, because I, being in this infertility field, and, we are seeing patients who are coming with infertility quite often. So, one of the things that, that young women, and women who are career oriented, and who want to delay their marriages or their pregnancies for a while, so it is very important for women to understand this. Like any regular, we do our health checks every year, but women, it's very important that you do your fertility health check as well. So, what is fertility health check? It includes it's a blood test called AMH. That's your anti-Mullerian hormone. So this hormone, it tells us about our ovarian reserve. So women have a very shorter span compared to men. Our fertility periods is quite shorter. So after 35 years, the quality of the eggs, that we produce in our ovaries, that quality starts declining. So it's very important for women to understand that, for whatever reason you want to postpone your pregnancies or your marriage, you're focusing on your career. So you need to get this AMH level done every year along with your routine blood test and your ultrasounds. So this will, give you an indication of if, in case your AMH is falling, then you can go ahead and freeze your eggs so that later on when you want babies around 35, 36, you're well settled in life, you're well settled in your career, now you want to go ahead. So we get so many women who come to us for IVF, and their egg quality has really gone down, or for natural conception also, their egg quality has gone down, and then they have to opt for a donor egg. So to avoid this, if you keep doing your regular fertility checks every year, you will get an idea that how healthy your eggs are and when you should plan your pregnancy or your fertility. And also, along with AMH, I would recommend that, once women are sexually active, it's very important that you do your gynae checkup done once a year at least. So this includes, your internal checkups, to rule out any infections, internal infections. Because sometimes, we've seen that women, they ignore their health. They are so occupied, with their houses, with their children, So they ignore their own health. But it's very important, because when you once women come to us at a later stage, it becomes a big problem. So you must keep in mind that once you're sexually active, once a year health checkup is very important. And also, I would recommend Pap smears. They are. I hope you've read about it, or if you haven't, Pap smears are basically a screening for cervical cancer. So it is recommended that once you're sexually active, you must do your Pap smears once in 3 years. So this will help. It's a screening test for cervical cancer, any early changes in the cervix, any HPV infections, that is human papilloma virus. So in case you are detected with these infections, we can treat you. And it is almost, you can reduce your risk of getting cervical cancer up to 99% if you keep doing your screenings and you take the HPV vaccine along with this. So, there are these 3-4 points, the pap smear, your HPV vaccine, your AMH level, and your checkups, regular checkups. These 4 things you need to keep in mind once you are sexually active. So, I think that's a lot of information to grasp at one go, but I feel that it's, very
Yeah,
important.
and I think we should take notes and yes.
Yeah.
Sure,
So,
sure. So,
yeah.
Dr. Dhwani, is there also the vaccine that you spoke about? Is there
Yeah.
also some vaccine or which protects you from cervical cancer at an earlier age? Because I remember reading about it.
Yes, absolutely. So, these cervical cancer vaccines, you can start giving your children from the age of 10 year onwards. So earlier, it was only for women, like only for girls. But now in India also, we've got the HPV vaccine for boys as well. The Gardasil 9. It's newly launched vaccine, and it is recommended to be given to boys as well, because it prevents certain cancers caused by the HPV virus, like your anal cancers, some throat cancers, some colon cancers. So, and for women, obviously, it prevents mainly the cervical cancer, again, anal cancers, and some warts also, genital warts. So they say that almost the efficacy is up to 99%. And the earlier the children get it, the better. The efficacy of the vaccine is higher. But women can take it up to the age of almost 45 years. So you must, if you have daughters who are, 10 plus, 10-year plus, you must go ahead and get them vaccinated. And if you yourself, you haven't taken the vaccine, I would recommend that, even if you're till 45, you can go ahead and take the vaccine. So you can, just get some benefits, if not 99%, but then definitely some benefit of the vaccine. So yeah, it is highly recommended.
So you're saying that from the age of 10 years to the age of 45? Is that
Yes.
correct?
Yes, right. 10 year to
Okay.
45 years. The
That's
dose
very
varies.
valuable information.
Yeah, yeah. The dose of the vaccine varies. In the younger children, it's 2 doses up till 15 years. And after 15 years, it's 3 doses of the vaccine.
Okay. So, doctor,
Yeah.
it's really great that you're spreading, the awareness around this because even till date, I was not, aware that even after 40 or at that age also you could actually take this. So,
Yeah, yeah. Earlier,
it's so
yeah, earlier,
lovely to, have you spread this awareness.
yeah, so this is, the guidelines keep changing. Earlier, it was only till 26 years, but now they've recommended that you can take it up till 45 years. So, why not? You have to protect yourself, and like, they say you have to be your own best friend. So, it's the more you take
Yeah.
care of yourself, it'll help you in life. So, you're like a force once you're your own best friend. So I really encourage women that come forward, just like you take your how you take care of your skin, of your body, of your external appearance, that is how you should take care of your internal body as well, and be aware about it. So it's very important to have awareness about these things.
Absolutely. In fact, being a mother to a daughter, I can definitely tell you that this is a very, very valuable piece of information. And, we would love to spread it to our entire community and, at least, have people be aware of it and then they can take a conscious decision. And so that's lovely. And thank you, Dr. Dhwani, for sharing that. Uh, moving on, you also spoke about freezing of eggs. So up to what age? From what age to what age can this be done? And also,
So,
what is the durability of those eggs? Like, how long can they be frozen?
right. So, see, the prime time, to freeze your eggs is between 30 to 32 years, and for whatever reason you want to postpone your pregnancy, this is the right time to freeze your eggs. And there is no limit up to till when you want to freeze your eggs, because, it is proven by studies that the efficacy of the egg, it does not deteriorate over time or over the years. So, the best example is, Miss World Dinah Hayden. She was one of the pioneers of, freezing her eggs. And then after 10 years of freezing her eggs, she went ahead and had her, IVF and had her babies. So she was one of the pioneer ladies who, decided to freeze her eggs. So I feel that now so many women are so career oriented, and they should know about this option of freezing eggs. It's called social freezing, and that the quality of eggs, it does not deteriorate at all. So it's I think it's like, just stopping your biological clock, and just not being scared and going ahead with your ambitions, and then when you're ready you have your babies later. So it's a really good option.
Sure, lovely. Lovely to hear about that, Dr. Dhwani, and I can tell you that everything that you're speaking can be, can actually impact lives, change lives, and help so many lives. So really very insightful. So, Doctor, there's always, a sense of, a certain amount of fear, or, in getting, the some of these advanced techniques done. So, are they completely like safe and for the woman? And what's really your view about it?
Yes, I would say that it is absolutely safe. If you go to any of the good IVF centers, it's being done in most of the IVF centers, and it is a very short procedure. It's done under general anesthesia. It would take about 15 to 20 minutes, and once the procedure is done, you are conscious again. So a few side effects could happen, like ovarian hypostimulation, but they are very rare. I would say about only 2 to 3% women have ovarian hypostimulation, but which is treatable. So it's fairly a very safe procedure. And definitely, if you giving you the option of a genetic child in the future, then definitely I would recommend that this should be done. And even the costing is not a lot. It's, I think, somewhere it would cost you around say 35 to 40,000 for doing this procedure. And there is a yearly fee to it that you need to give to the bank, the egg bank, to keep freezing the eggs. Every year it has to be renewed. So that is how it works. So but at least your options are open. So yeah.
Sure. So, Dr. Dhwani, a lot of women go through, various issues on the, related to fertility. How do we really create more and more awareness around some of these, even the things that you spoke of, I'm not sure how much really awareness is there around a lot of women to be able to leverage on this information.
Yeah, so I feel, that definitely through, I generally talk about it on my social media platforms, and even other doctors have to come forward, you know, talk about it, because I've seen a lot of doctors are not very comfortable with public speaking also. So, it is, I feel that if we have maybe some camps in corporate offices or in your localities where, we can talk about it, especially on social media platforms, which is very popular nowadays. So on Instagram, wherever. So, these are the ways. And definitely on internet also, you will get information about this. But yeah, you're like a platform like yours, Sages. So now you have taken the initiative to talk about this. So encourage women and educate women about this. That's the only way. So that is the reason, that a lot of women don't know about this. So when I talk about it to, my patients, I generally, when they come to me, for their routine checkups, I do and keep educating them, about their Pap smears, about their routine checkups, about vaccines. So it has to be like a continuous process. So yeah, a lot of efforts from the doctor's side, yes.
Sure, Dr. Dhwani. And just to inform you, we have about 10,400 women who have registered with us. Of course, they're not on the app as yet. Gradually, they are coming, signing in, and moving on the app. So, we would love to spread this awareness and message definitely to our entire community. And we would love to have you back, for a more dedicated